From training and practice across Europe to treating thousands of patients in the UAE, he has spent 48 years in the intersection of surgery and the human movement, doing everything from complex joint replacement surgeries to treating everyday injuries that shape how we live and move. In today's conversation, we'll cover everything from how medicine has evolved to the real truth of the back pain. We'll go over the MRI reports, what they actually tell us and what they don't, and why so many people misunderstand their diagnosis. We'll break down disc injuries, spinal conditions, and when surgery is actually necessary. Then we will shift the focus to movement, prevention, and the lifestyle. For active individuals and coaches, we will talk about how to safely train with the back issues, what to look out for, and how to safely build the long-term back health. This isn't a conversation just about orthopedics. It's about longevity, resilience, and what truly keeps body functioning at its best. Ladies and gentlemen, Dr. Laith Bakir, welcome to Posture Performance Podcast.
Thank you very much, Mr. Alexa, for inviting me for this Posture and Performance podcast. Happy to be with you and give you whatever information I can provide to this podcast and to the different types of trainers.
Really a pleasure having you here.
Thank you very much.
An outstanding 48 years of experience. What is the biggest advantage of modern time and what is the biggest disadvantage of it compared to the time when you started your career?
I started for nearly 48 years as orthopedic surgeon. Of course, started with the training. Previous days were mainly focused on clinical examination. You press here, this sign, indication that this patient has disc prolapse. You do this test, indication of irritated nerve. But nowadays, the problem, I would say, the doctors will just say, patient has back pain. Okay, quick examination, x-ray, just go for MRI to see what's the problem with you. This difference has limited our clinical or physical examination of the patient. Now, mainly they're depending on modern technological investigation like MRI, ultrasound, which has, I would say, improved our diagnosis, but limited our clinical objectives.
So you would appreciate to have a bit more time with a hands-on approach?
Definitely. There is no doubt about this.
Is there something you believed in at the beginning of your career that you disagree with now?
This is a nice question because in the beginning, when I graduated, any back pain, I used to tell the patient, just lie on the floor. Put a blanket and lie on the floor, which is now by modern science is wrong because the bed or the mattress should take the shape of the body. By all means, sleeping on a hard mattress is harmful for the back. The other thing that I remember, we used to give the patient with back pain or disc prolapse extended periods of sick leaves, 3 weeks, 3 months, until recovery. But now the modern science would say maximum of 3 days bed rest, otherwise the back muscles will get atrophy. Even in the acute phase, we should teach the patient to do some stretches for the spastic muscles to improve his mobility.
So movement even while irritated?
Movement while irritated, it doesn't increase the pain. There is a stretch, but the pain will be less when you release the spastic muscles.
So it should be guided by someone who really understands what is going on.
Yes, exactly.
How much did the technological advancements speed up the recovery process and to which extent did they elevate the treatment of the patients?
Before the invention of MRI, which was invented, as I remember, 1986, at least I heard about it, so it's nearly 40 years. Before, we couldn't diagnose if the patient had really a disc prolapse or a back problem or not. Sometimes, I remember the patient just fake sickness or to get sick leaves or to be out of work. And of course, they get compensated for this. We used to have a special test, which is now not available anymore. We used to put the patient asleep and do some test. If the patient has pain while he's just waking up from the anesthesia medicine. We used to know that this is real back pain. But if he come and bending his back and I have back pain, we couldn't tell if it is real patient or fake patient. So invention of the MRI has helped us a lot to diagnose how big is the disc, the level of it, and whether he needs further treatment or further care or surgery or this. All this was done by the invention of MRI.
Beautiful. You have quite an interesting anecdote. For how long were people in Dublin using their sick leaves before it?
Oh, a lot. And I tell you, for every week they used to come, they didn't improve, they get a sick leave, and of course they get compensated for this.
If I'm not mistaken, there weren't only weeks.
Yes. By the way, especially if there is, like for the neck, if there is a car accident and they're waiting for compensation and they're waiting for the court to submit, and all this, they will take up to 3 years. If they don't get their compensation, it will be difficult without diagnosing them as real disc problem or spine problem. It will be difficult.
MRI didn't only make your life easier, but for the insurance companies too, I believe.
Exactly.
Majority of the clients that we are dealing with come with a history of the back pain. And doing the initial assessment, we do an extensive interview where we ask them about their conditions, etc. So we will know a lot about their body. But when asked about the degree of the damage they have, the main response will have, "Coach, I have disc." Okay, I know you have disc, and I'm quite sure you have another 22. But their knowledge is limited to the point that they know they have the disc problem and nothing else about it. What is the extent of education doctors should give their patients about the condition they have?
A disc problem sometimes, it's a general word, of course, as you mentioned, that everybody will have a disc. Even I'll come later on in a disc problem comes with age, might be, because they did a study. I'll come to it soon. Unfortunately, some doctors, they don't tell it is a small disc or medium or big. Patient, when he feel that there is a disc, is very frightening word for them. Sometimes they feel the end of their life, end of their job, end of their sports, end of everything. So we should really educate the patient that it could be a natural process like gray hair. And this shouldn't prevent him from doing exercise at least, or the suitable exercises for him.
Of course. And even if someone young shows up, the doctor should talk about him, what might have led to that, I do believe.
Yes, it could be a wrong movement, wrong lifting. This has initiated this. But not every back pain as well is a disc problem. It could be muscle spasm, it could be other problems.
And I do believe that this is incredibly important for people to understand. Not every back pain is a disc injury. There are 4 degrees of disc damage. Can you please break them down and tell us what is specific about them from anatomical standpoint, and which of those are reversible, which are not? And what are the treatments for each one of those?
It's nice to have the patient to have a knowledge about a disc, because a lot of them, they don't know what is a disc. Disc, in actual fact, I would say like a rubbery material that between the vertebrae, and the benefit of it, of course, is to encourage the movements. Imagine if it was all bone, one piece, you cannot bend. So this is like a joint that facilitates the movement of the spine. In addition, it works as a shock absorber for any impact. Now, anatomy is like a skin of onions, layers, layers, layers. And every time a crack in one layer will cause pain. Now, if it is a small crack in the disc like this white one, it's a protrusion. If it is bigger, like the red one, it's a prolapse. Then it goes to, if the material is out and it comes in the spinal canal, it comes like sequestration. Now, we should differentiate. A lot of patients, they don't know the difference between a disc and sciatica. If the disc is pressing on the nerve, same disc prolapse, pressing on the nerve, it will cause the nerve to be irritated, will cause sciatica. So there is what we call disc prolapse with radiculopathy when it presses on the nerve, when the patient feels the pain in his leg. Now, if the disc pressing on the spinal cord, this the one in the center, it causes disc prolapse with myelopathy, which affects the myelopathy means the spinal cord itself. Now, the treatment as initially will just, of course, rest, medication, physiotherapy, and we see according to each case.
And that's something very important. Each case of the back pain is unique.
Yes.
And it requires different individual approach. You mentioned that the disc can actually press the spinal cord. What is spinal stenosis and what does it carry with itself?
Spinal stenosis is a chronic disease when the disc prolapse plus the soft tissue around the spinal cord become thick. So the spinal cord becomes strangulated or stenosed. Narrow. Of course, this will cause the patient not acute pain, but chronic pain. When he walks, he feels pain in both legs. When he walks, sometimes he do some tricks as bending his back. It will increase the volume or the space of the spinal canal, which relieves the pain.
So as far as I understood, the narrowing of the spinal canal can hinder the transmission of the signals through the spinal cord.
Exactly.
And then we need to look for the postural strategies on how to facilitate those. Spinal surgery is a very controversial topic. We are all on the mission to help people avoid it as it has downsides. But when is it unavoidable? What qualifies the patient to undergo a spinal surgery?
We can divide the surgery into many types. For example, if the patient has a disc prolapse, initially we treat him as a conservative treatment by medication, physiotherapy, exercises, and we wait. We wait as much as possible, up to 2 months. If the patient, for example, cannot go to work or perform his job, like mechanical or this, he might lose his job. After 2 months, patient is fed up, he's in severe pain, in agony, surgery is considered. Now, there are other types, which is like emergency surgery, what we call coda equina syndrome. Patient has disc before, and he lifted heavy weight or bent his back or sneezed or vomited, and the disc will go like a bullet into the spinal cord. This is an emergency treatment and should be done within 12 hours, if not less. Otherwise, they lose control of their function, the movement. As we mentioned, the spinal stenosis is not an emergency, but if the patient is young, relatively young, like 50, 60, and patient is active, the spinal stenosis is an indication for surgery. But if the patient, as I saw the other day, patient is 80 years old, definitely we don't touch him by medication only.
So you will estimate what is the harm, how much will the patient gain from the surgery, and then decide.
Yes. As you mentioned, every case is unique, should be judged by not to make it universal as each disc needs surgery. Definitely no.
We said a lot about the surgery, and I do believe some people are scared from it. In reality, most of the patients you will see will never lie on your table.
About 95% of the patients will not need surgery, even with a disc prolapse.
So speaking of that, is herniated disc that scary, or how do we manage it?
We manage it conservatively by, as I mentioned, by medication. But the problem, we should not forget, the disc prolapse is mechanical problem plus inflammatory, as somebody got a fist on his face. There is inflammation, and this needs time to settle, to improve. The problem is the patient will need immediate improvement, which is not suitable. That's why I see a lot of patients going to second opinion doctor, or they want immediate magic touch to improve their pain, which is, there is no such thing. It needs time, really. It needs time to improve. Sometimes I tell them you have to have good patience up to 2 months to resolve.
A couple of times you mentioned a conservative treatment.
Yeah.
I do believe that some of the modern treatments offer the immediate solution.
Unfortunately, yes, I have seen this, and they tell the patient that you need immediate surgery. Otherwise, for which I don't believe. I'm on the conservative school.
So try everything before the surgeries. What is the reason for that? What is the downside of the spinal surgery?
This is a very famous study. They found the patients who do surgery and the patients who don't do surgery are the same after 2 years. Same result. So why to do surgery?
A herniated disc on the MRI image doesn't necessarily mean that it's the main source of pain. Is that true?
Yes, sometimes the patient has a disc on the MRI. Remember, the MRI is it's a very advanced technology that you can see the minor things in your spine, like putting your hand underneath the microscope. You will see a lot of things. Sometimes even the patient say, okay, I have done this surgery, but my back pain is still there. So arthritis of the back, sometimes postural problems will aggravate. Okay, he has a disc, as I mentioned, but postural, his position in the office, and this will increase. Sometimes gynecological problem, stomach problems, a lot of things. So this we should not miscalculate or forget about it. What are the other causes? Not because we found a disc prolapse in the MRI, and this is his main cause of pain. We should treat the patient, not the MRI.
Can you please expand a bit more on the back arthritis? And there is something very interesting about the MRI. The MRI imaging is done in the lying position. But what happens in the presence of gravity?
I would say arthritis of the back there are two types. Between the vertebra itself, see, this one is what we call osteophyte or bony protrusions that due to friction and micro movement between the vertebrae, the body try to stabilize itself by putting this osteophytes or bony protrusions. As well, we have between the facet joints, between these joints that hold the vertebrae together, facet joint. Sometimes some doctors do facet joint injection, but this is a cause of pain, constant pain. Even there is a disc or without a disc, arthritis of the spine is a cause of pain. Now, regarding the MRI, there is one type of MRI, what we call dynamic MRI, which patients do in sitting position. But because it is expensive, didn't find much field in the clinical practice. Plus, of course, if you're doing in sitting position or bending or extension, it increases the load on the vertebrae and the disc.
You have mentioned earlier that due to aging, we simply get herniated discs. What percentage of people with herniated discs are completely asymptomatic?
They did many studies, what we call random study. People passing in the street, come, let's do MRI. Come, let's do MRI. And surprisingly, they found at the age of 20, they found 30% they have disc problem. And they are not complaining. At the age of 30, 40%, it goes like this. At the age of 50, 60% have disc problems. People passing in the street, random studies. So that has a clear situation that not every disc problem is a cause of pain or suffering of the patient. As I tell my patients, it's like a gray hair. Don't be afraid of gray hair. Everybody will get it, and not necessarily a cause of your problem. It could be what we call incidental finding that you have a disc problem.
So people, you can live with a disc damage and be totally asymptomatic. And I do believe that this was a big concern of many listeners to this podcast. But this triggers another question. And what percentage of the people with a clear MRI will feel the back pain?
As I mentioned, back pain could be back pain as such. could be to sacroiliac joints, which is the joint at the back connecting the pelvis with the spine. It's a cause of back pain. And sometimes there are trigger points, especially in the upper back near the scapula. There are trigger points that you press on it and it causes severe pain. Sometimes a clear MRI, but patient has stress. Stress is well known to increase back pain. If the patient is stressed, could be his position in the office. It is by itself, sitting in the office is a cause of back pain.
And it's scientific as far as I know. It's not something we're just saying experientially, but the science has actually proven that the long-term sitting is the risk for back pain, regardless of there is a finding on MRI or not.
Yes.
Let's shift an attention to the exercise. How important is having an educated professional when engaging in physical exercise, having a spine injury or any other back condition?
I would like to say there are two types of coaches from my experience. I've been training for a long time. There are two types of coaches. Some coaches, unfortunately, have seen few exercises on YouTube and they follow and they have no background of the muscles, of the anatomy, of the physiology. I would say this type might be a little bit dangerous for the patients, for the trainees. The other type who has the background of all the knowledge about physiology, this muscle, how it works, which is painful, where is the pain coming from. I see some trainers who insist more pain, more gain, which I don't believe in this because this will injure the muscles. And I have seen a lot of patients that they go training for 2 months and they quit training for 2 years because of that injury or that negative feedback that happened to them. So trainer should be knowledgeable enough and has studied the science of training, not haphazard or just come and lift heavy weight and do this and do this and do this. And I have seen it in the gym. Sometimes they're not merciful on their trainees. Do this, lift this, you have to do it. It's not, I don't think it will work this way.
Us coaches look on the effects of training process as adaptation to something. So we will give the stress or the training to someone and the improvement will not happen immediately, but after the person adapts to a certain kind of training.
Exactly.
Is maybe an injury the strategy for someone to adapt on what coaches are, or the strategy of the body to avoid some of the harmful things coaches are potentially putting them through?
I think the interaction between the trainer and the trainee is very, very important. That this is painful. The trainer can proceed which type of exercise is suitable for this type of trainee or this person. You cannot unify all the exercises for all the trainees. This is suitable for X. This is suitable for Z. This is very important.
And this is something we're promoting the big time. No two bodies in the world are exactly the same, and we all have something specific to ourselves. For some time already, I've been seeing you twice a week, and our conversations elevated my understanding of the human body massively. Some of my clients came to visit you. You referred a couple of people to come to train with us, and it functions perfectly as we are in the constant communication. Most of the coaches do not have that privilege. Which kind of instructions should coach ask from the doctor about the client who is coming with a history of the back pain?
Back pain, I usually advise the coach and the patient not to do, for example, deadlift or heavy lifting, because there are so many exercises that the coach will give to the trainee how to strengthen his back, how to do his core stabilizers, which reduces the pain by itself. For example, lifting one hand and one leg to strengthen the core muscles, like swimming, water walking, side planks. The coach will help a lot in reducing the pain, back pain, and to strengthen the core muscles. When the core muscles are improved in strength, definitely the back pain will improve. We don't want the patient or the trainee to continue taking medication forever for his back pain. So doing these exercises, which is with a knowledgeable coach, will definitely help the patient.
So we need to appreciate the condition, and we need to appreciate, as we mentioned earlier, individual differences between.
A good cooperation between the coach and the doctor is beneficial for the trainee or the patient.
Is sitting really a new smoking? Or it's just another myth that fitness influencers made on the social networks? We know that the back pain is one of the most prevalent diseases nowadays. How many of the patients that you are seeing are reporting the sedentary lifestyle and the sedentary work environment?
Well, a sitting position, I always tell the patient, do you pay tax? He said, no, I'm not paying. I tell him the tax of your sitting job is your back pain. Back pain is very much related to sitting posture or sedentary life. Always I mention that sports people or even laborers who work in the factories, they don't have back pain. Rarely they come. Most of the people who come are housewives, office workers. They don't do any sports or any exercises. Mind you, they say 80% of people in general at one stage of their life will have back pain, and 10 to 23% will have chronic back pain because of different reasons. This is the prevalence of back pain. Back pain is very prevalent in the population.
But if we take that example and take people who sit for a longer period of time, they will be more likely to experience.
Definitely. And there are other factors, we'll mention it probably.
So people move, and you'll be less likely to
even
back issues.
They mention that you have to get up, the benefit of the modern watch, and you have to get up every 30 minutes. Get up, stretch, and do some exercise and go back to your seat.
My clients are getting recommendation on 19 minutes. There is a recent research that says that passive stabilizers, the ligaments, will stop losing the integrity after 20 minutes. Probably after 30 minutes more significantly, as it doesn't happen like just in one moment. But yes, the new recommendation people are getting from us is 19. And I do believe that the new smartwatches are set up around that time. I get the notifications, stand up and move.
Okay.
We know that sedentary lifestyle can bring other issues too, like obesity and just being overweight. How much body composition matters when it comes to back pain? Are overweight people more likely to see you, or it doesn't make any difference?
Definitely. There is no doubt about this. And they found that people who their BMI is more than 35, they will have four times more back pain incidence as compared to thin people. Overweight will bring structural load on the discs because of the axial load. For example, a pickup that tolerates 1 ton, and you put 3 tons in it. Definitely after 1 month, it will go break. Structural loading, this is one cause on the discs itself. The other thing, it will bring hyperlordosis, which means a big tummy, which will increase the curve of the back. The back will become like this because of the big tummy. That's people with weak abdominal muscles, weak tummy muscles will get big tummy, and this will cause their back pain. Plus, the fat tissue, adipose tissue, by itself is pro-inflammatory. It causes some inflammation. It doesn't heal well. Plus, it's a cycle. You have back pain, you will not move. Obesity or this will cause back pain. Back pain will cause less movement. Less movement will cause more obese, more increase in weight. More increase in weight, more pain, like this. A loop. It's a loop. That's why sometimes I feel pity for them. Plus, God forbid, if they need surgery, what can you do for them? Nothing. Because some patients are really overweight and really difficult to treat. We encourage them to lose weight and to do exercise. But they reach to a certain stage that movement will cause pain, less movement will increase their weight. So it's a cycle.
I think that we answered this question to some extent, but this is a golden question, so I would like you to update a bit on it. What is a way to reduce the probability of getting the back pain?
This is a very important question. We should do mastering of spine hygiene. I always mention that our parents told us to brush your teeth 3 times per day. This is teeth hygiene. But they didn't teach us to take care of your back. Now the teeth can be replaced, could be implanted, but once the back is damaged, you cannot replace it, and it will stay with you for the rest of your life. They say back pain tortures. It doesn't kill, so it is a torture. Spine hygiene is very important. How to lift. I would mention this. How it should be from the hip hinges, like this, from the hip and the knees. If you bend your back, whatever simple thing, your back will open. This is very important. Plus, as we mentioned before, frequent stretches for the back, for sedentary job. How to stand it's a lifestyle in actual fact. How to stand. Most of the patients that I see, ladies, they enter the kitchen 7 o'clock in the morning and they leave the kitchen 3 p.m. No break. And of course, longer standing is a cause of back pain. By all means, you should stand and put your weight on one leg and alternate every 10 minutes, 10 minutes, 10 minutes. This will reduce the stress on the back. And physical activity and weight, no consideration of the weight since childhood. I see some that their children are very overweight, and this will remain, unfortunately, with them, with all the consequences. Plus, I just remember one thing, that sedentary life is a cause of heart problems and early death and instability and a lot of losing the balance, This is a lot of hazards, and it reaches to a stage that, they cannot do their daily activities, which is very dangerous.
To make it simple, proper movement, moving correctly and often enough, correct way of standing, reducing sitting, reducing the weight.
Exactly. All this, we call it spine hygiene.
How much office ergonomics matter? A lot of the people I met recently have the standing desks where they can shift between standing and sitting. Some of them even brought treadmill into the office so they walk and work at the same time.
I have seen one fellow long time ago that he said, my chair is 10,000 dirhams, but the way you sit, whether you sit like this, even the most expensive chair, and you sit like this, or with your back supported and extended, is very, very important. Plus, not to mention now the modern disease, I would say, with holding the mobile like this will increase the load on spine of the neck, cervical spine. This will increase the load by 3 times. The weight of the head is 5 kilos, but if you bend your neck like this in 30 degrees, it's 15 kilos. 3-fold weight increase.
I believe that this is the topic that the two of us will have to cover in the future podcast, because we can expand till forever. And this is something that is very important for parents to teach their children from young age, the way, first, to reduce the screen time, the second, even when the screen time is on, how to properly set up the posture.
Exactly.
We gave an opportunity to our followers to ask you a couple of questions. So let's start with something we've been talking a lot, but Annika asked, do you agree that movement is most commonly the solution?
Yes, movement is very important in actual fact, to keep moving. Other thing that I forgot to mention is to stay hydrated, and smoking. Very important, that very strong relationship with healing of soft tissue injury, bone injury, and back pain. neck pain with smoking is strongly related.
This is something very strong. So people who don't smoke are less likely to
have a quicker recovery. But people who keep moving is less exposed to back problem.
Regardless of smoking.
Yes, definitely.
We have the question from Mr. Rashad. What is something you would like all of your back patients to know about the back pain?
Back pain, it comes as a stage of, short period of life. As I mentioned, 80% might be exposed to certain period of their life back pain, but it's a treatable disease, treatable condition. It's not the end of your life or the end of your careers or this. It can be treated, it improve, but with your effort. If you don't do any effort, unfortunately, I see sometimes some patients keep going from one doctor to another, just trying for magic solution, without listening to me. I spend usually 40 minutes to explain, do this, don't do this. This is very important. As I mentioned, we should not depend on medication and this to cool down the pain. Should be effort from the patient himself, and part of it is doing training. I refer a lot of patients to do training and to be active in their life. If they are not active, the pain will continue.
Unique concept on pain, very unique philosophy that the pain is actually our friend, our alert that something is wrong, and as you mentioned, that we should do something about it, that yes. we should engage in something to reduce that pain and to help ourselves, our body, our metabolism that way.
Yeah, pain, in actual fact, I always tell them is a gift from God,
Exactly.
Because there are some conditions that congenital from birth, they don't feel the pain, and their fingers finish because they don't feel pain. Pain is like a red light in the car. It gives you a signal. You should do something about it. Initially get a little bit of treatment to reduce the pain, but then you continue with training, increasing strength of the muscles to decrease the load on the spine. If you strengthen your core muscles, the tummy and the back, it will decrease the load on the spine. And same for the knee, same for the neck. Once the muscles are strong, the load on the bones and the joints will decrease, and the pain will definitely decrease.
Doc, thank you very much for this conversation. I really enjoyed it. It was very informative, as always. I've learned something new, even though I came prepared for this. It's a big honor having you on our podcast. How can some of our listeners who liked what you had to say here can find you to get maybe the consultation or your professional opinion?
First of all, I would like to thank Posture and Performance for this podcast. Very enjoyable, and I hope I was helpful for this,
Definitely.
For you and for the listeners. My name is Dr. Laith Bakir, consultant orthosurgeon. I'm practicing now after the government. I'm practicing in Ibn Nafis Medical Center in Abu Dhabi. So most welcome for the patients or the trainees who need medical opinion, and we can do some helping advice for them.
Anyway, I will leave the link to your clinic in the description of this podcast, or people can simply contact us and we will share your contact. Thank you very much once again, and hope to see you in some of the next episodes.
Thank you very much.
Appreciate it, really.